This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 36 of a 58-part video series of the entire book, chapter by chapter. Please review the introductory video for a background. Part 36 goes into the subject under diet regarding soups. I thought I would throw that in there. It's not something you would normally find in most heart disease treatment books, but with heart failure, soups can become a part of the therapy program because in nearly every case, subjects with heart failure have to lose a considerable amount of weight. The more body weight you have in your chest, the more pressure and back pressure you have upon the heart, and we have to reduce back pressure to a minimum to enable sufficient blood flow to the heart for the regeneration of the muscle tissues. Now, soups can be deadly as far as salt content, but there are tricks to making good soups and modifying canned soups so that you do not bust the budget of sodium that you need to have for proper heart regulation. I used to visit Cape Cod in the spring, not long after they had the clam chowder competition. So we would go from restaurant to restaurant, and all we would order is a bowl of clam chowder because they were in the top 10 winners of the awards. It was simply fabulous, unbelievably wonderful. However, most soups are based entirely on salt or sodium. Nearly every soup on the market has high levels of sodium. Even Healthy Choice chicken soup, it will say 390 milligrams of sodium, but when you look at the back of the container, you find out that that's only for a cup, not a bowl. A bowl amount would be double that, or almost 800 milligrams. The recommended sodium target is 2,500 to 3,000 milligrams each day, depending on if you are taking diuretics. The diuretics are medications that just randomly flush sodium from your body without control, whereas if you're taking enough potassium, your kidneys will regulate it properly. The lowest sodium of any soups I know is the one I mentioned. That's 390 per cup, or nearly 800 milligrams per bowl. Many soup manufacturers have tried to lower sodium only to lose market share, so they keep bringing it back up. One thing I have found, there are some great soups that I just enjoy eating for lunch. So what I'll do is I will cut the soup in half. I will mix in half a can of coconut milk, half a can of regular dairy milk, and maybe add a little more spices. And essentially what I've done is a bowl's worth of soup has now been reduced to half of the label on the back of the can. So therefore it falls within a reasonable sodium intake for the entire day. We could spend more time on soups, but making your own soups is actually the best choice. Making a good soup is relatively easy once you pick up a cooking recipe book that has an entire section on soups. The primary secret is to use a low sodium cooking stock, or even make your own. The best way is to just put a 6-quart pot on the stove, add a little bit of chicken, onions, and almost a dozen stalks of celery, and let it simmer over slow heat for a couple of hours. Then add your spices and ingredients, and you don't have to add any more salt than what you need for taste, and no more. Just keep your sodium budget well under 1,000 milligrams per meal. In summary, a full meal of soup could be 300 or 400 calories instead of 1,000 or 2,000 calories as most fast foods are. That way, soup can be used to fill your stomach with a nice, rich flavor and yet not bust your budget as far as calories per day, because you need to keep your weight at a fairly modest BMI. Somewhere between 20 and 24 is where you want to target your body mass index. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available on Amazon in print and Kindle edition. from the Apple iTunes Store as an iBooks edition, on eBay in a print edition, and directly from the publisher, Wilkerson and Hughes. P.O. Box 777, Altoona, Florida 32702. Just enclose a check for $24 to cover the shipping and handling. Thank you very much for listening.